Hello. Today we're discussing global health economics. I'm Arujan, your host representing the biomedical perspective.
And I'm Jangir, your other host, bringing the economics angle into this vital conversation. In this podcast, we'll investigate the economic challenges and disparities in global healthcare systems and discuss issues like healthcare infrastructure, access to medicine, and the role of international organizations and aid in addressing global health inequalities.
Today, we're delving deep into a topic that touches every corner of the world: global health economics.
Yeah, that's right, Arjan. Healthcare isn't just about well-being. It's also a significant economic force. A healthy population can drive economic growth.
Absolutely, and a sick population can have the opposite effect. So why is global health economics so crucial?
Segment 1. Healthcare infrastructure. To start, let's talk about the healthcare infrastructure. In many low-income countries, inadequate healthcare facilities pose a significant barrier to accessing medical care.
Let's start with the question, what is healthcare infrastructure? Healthcare infrastructure refers to the system of organizations, personnel, and resources that work together to deliver healthcare services and support public health efforts within a community, region, or country. It encapsulates a wide range of components, including hospitals, clinics, laboratories, healthcare workers, medical equipment, transportation systems, communication networks, and etc. The quality and adequacy of health infrastructure are critical factors in determining the overall health and well-being of a population.
Now let's answer the question, what are the challenges faced by low-income countries? Challenges in health infrastructure in low-income countries are diverse and multifaceted, often resulting from limited resources, inadequate facilities, and a shortage of trained healthcare professionals. Here are some real-life examples of challenges faced by low-income countries in terms of healthcare infrastructure. Inadequate access to healthcare facilities. So that's number one. In many low-income countries, a significant proportion of the population lacks access to basic healthcare facilities. This is due to scarcity of healthcare centers, particularly in rural areas. Number two, shortage of healthcare workers. Low-income countries often face a severe shortage of healthcare professionals, including doctors, nurses, and pharmacists, leading to high patient-to-healthcare worker ratios, according to the World Bank. Number 4. Lack of equipment. Many low-income countries struggle to procure and maintain essential medical equipment, such as diagnostic tools and surgical instruments, leading to suboptimal patient care. Then we have limited access to safe drinking water and sanitation. Poor access to clean water and sanitation facilities contributes to the spread of waterborne diseases and hinders efforts to maintain public health. Challenges in vaccine distribution and immunization programs. For example, during COVID, low-income countries often face difficulties in distributing vaccines and implementing immunization programs due to infrastructure limitations, leading to lower vaccination coverage. So, these examples highlight the significant challenges that low-income countries face in building and maintaining adequate health infrastructure. Addressing these challenges is essential for improving healthcare access, reducing morbidity and mortality, and advancing in public health in these regions.
Now let's tie this back to the question, what is the economic impact of this? So one of the first points is lost productivity and labor force. Poor health infrastructure leads to higher mortality rates and increased morbidity. As a result, the labor force in low-income countries is often affected, leading to reduced productivity. According to the World Health Organization, low and middle-income countries lose an estimated 15% of their labor force productive years due to disability and premature death. Second point is increased healthcare expenditure. So inadequate health infrastructure may force individuals to seek more expensive private healthcare services or travel long distances to access care, leading to increased out-of-pocket healthcare spending. The World Bank reports that in low-income countries, over 85% of healthcare expenditures are financed through out-of-pocket payments, which can lead to financial hardship for families. Now, the third point I want to make is the impact on economic growth. So weak health infrastructure can disrupt countries' economic growth by reducing the overall productivity of the workforce and increasing healthcare costs simultaneously. So a study published in The Lancet estimated that the economic burden of non-communicable diseases alone could cost low and middle income countries up to $7 trillion over the next 15 years. And now the final point that I want to make is the impact on education. So poor health infrastructure can also affect education outcomes. So sick children may miss school and their cognitive development can be impaired, potentially reducing future earning potential. A study by the World Bank found that healthier children are more likely to attend school regularly and perform better academically, therefore contributing to human capital development. Now we're going to move on to the second segment of the podcast, which is going to be access to medicine.
So another major challenge is access to medicine. The high cost of essential drugs can make healthcare unaffordable for millions.
And let's not forget the issue of intellectual property rights, which can limit access to affordable generic drugs.
So let's focus on what are intellectual property rights. So intellectual property rights, such as patents, copyrights, and trademarks, provide creators and inventors with exclusive rights to their inventions for a specific period of time.
However, the problem is that under patent protection, pharmaceutical companies have a monopoly on the drug, allowing them to set high prices without competition from generic version. This often results in higher drug prices, which can be a barrier to access for patients and healthcare systems. The high cost of patented drugs can limit access to essential medicines, especially in low and middle income countries and for patients without insurance coverage. This can have serious public health implications as it may prevent individuals from receiving necessary treatments.
Government and international organizations are exploring various policy solutions to address high drug prices, including patent reforms, price negotiations, and drug price transparency initiatives. These efforts aim to balance the need for innovation with the necessity of making medicine more affordable and accessible. We will delve deeper into the segment 3. In segment 3, we'll delve deeper into the role of international organizations. So, now let's shift our focus to international organizations. Entities like World Health Organization and UNICEF play a vital role in global health economics.
That is right. They provide guidelines, funding, and technical support to countries in need. International organizations such as the World Health Organization and the CDC monitor the global spread of diseases, assess health trends, and provide early warnings of potential health crises.
These organizations develop and disseminate evidence-based public health policies, guidelines, and best practices to assist countries in addressing health challenges efficiently. They work to strengthen the healthcare infrastructure, human resources, and technical compatibilities of low and middle income countries to enhance their ability to respond to health emergencies. Moreover, they support research on diseases, vaccines, treatments, and healthcare delivery methods to advance medical knowledge and innovation.
International organizations also provide rapid response and assistance during health emergencies such as pandemics, natural disasters, and humanitarian crises. International health organizations are funded through a plethora of different ways. For instance, they rely on voluntary contributions from member states, philanthropic foundations, and private sector partners to fund their operations and programs. Some organizations like the Global Fund to fight AIDS, tuberculosis, and malaria operate as financing mechanisms, pooling resources from various donors to support specific health initiatives. Now we're going to focus
on segment 4, foreign aid and transparency. Foreign aid is another critical component. It can make a massive difference, but it's crucial to ensure that aid is used effectively and transparently.
Indeed, accountability is key. Let's not forget that many lives depend on the proper allocation of aid.
Foreign aid plays a pivotal role in addressing global health challenges. It channels financial resources to low and middle income countries, helping them invest in healthcare infrastructure, disease prevention, and treatment. Aid provides humanitarian assistance during health emergencies and crises, offers capacity building through technical training, supports vaccine distribution, aids in controlling diseases, enhances maternal and child health, and strengthens the healthcare systems. Foreign aid is essential in reducing health disparities and improving the well-being worldwide.
So, examples of successful aid programs include the Global Fund to fight AIDS, tuberculosis, and malaria. This global partnership has made significant progress in combating these three major diseases by providing funding, technical expertise, and support to affected countries. As well as that, Gavi, the Vaccine Alliance has played a pivotal role in increasing access to vaccines in low-income countries, leading to the immunization of millions of children and the prevention of numerous diseases. Moreover, the PEPFAR, President's Emergency Plan for AIDS Relief, is a U.S. Government initiative, and it has supported comprehensive HIV/AIDS prevention, as well as treatment and care programs in multiple countries, contributing to significant reductions in HIV-related deaths. Moreover, the Carter Center's Guinea Worm Eradication Program, so through a combination of health education and the provision of clean drinking water, this program has made remarkable progress in eradicating Guinea worm disease in several countries. And finally, the Rollback Malaria Partnership. This global initiative has mobilized resources and coordinated efforts to reduce the burden of malaria, resulting in a decline in malaria-related deaths in many endemic countries.
That's impressive. Transparency and accountability is extremely crucial in aid distribution. They're vital in distribution for several reasons. Reason number one, effective resource allocation. Transparent reporting of aid flows helps ensure that resources are allocated efficiently, addressing the most pressing health needs. Number two, preventing corruption. Transparency reduces the risk of aid funds being diverted or misused for personal gain, ensuring that aid reaches its intended beneficiaries. Number three, stakeholders' trust. Transparent aid distribution builds trust among donors, recipients, countries, and the public, which can lead to continued support and cooperation. Number four, data-driven decision-making. Accurate and timely reporting allows for data-driven decision-making, enabling aid organizations and governments to adjust strategies based on the real impact of aid programs. And last but not least, accountability to beneficiaries. Aid recipients have the right to know how and where the resources are used, and they should hold aid organizations accountable for delivering results. So now let's move on to segment 5, case studies. To illustrate the real impact of global health economics, we have some case studies lined up.
These stories will show how countries have navigated these challenges and disparities.
So, case study number 1, the impact of global health economics. The Global Polio Eradication Initiative. The Global Polio Eradication Initiative, or the GPEI, is a public health campaign aimed at eradicating polio worldwide. Polio is a highly contagious viral disease that can cause paralysis and death, particularly in children. The initiative began in 1988, and since then it has made significant progress in reducing polio cases globally. The GPEI's success is not only due to scientific advancements, but also smart global health economics. It demonstrated the cost-effectiveness of vaccination campaigns by providing oral polio vaccines to children in endemic countries. The initiative prevented millions of cases and saved billions of dollars in long-term healthcare costs. The GPEI relies on funding from various sources, including governments, foundations, and the international organization. The economic argument for eradication has attracted substantial financial support, showing how global health economics can mobilize resources for a common goal.
Now, the second case study is tackling health disparities. So we're going to focus on Rwanda's health system reforms. So it is a low-income country in East Africa, and it has made remarkable progress in improving its healthcare system and reducing health disparities. Rwanda implemented a community-based health insurance system, which made healthcare services more affordable and accessible to a majority of the population. This system significantly reduced financial barriers to healthcare, especially for vulnerable groups. Moreover, Rwanda invested in expanding healthcare infrastructure, including the construction of health centers and hospitals in rural areas. This improved access to healthcare services for remote and underserved populations. The country trained and deployed community health workers to provide essential health services at the community level. This approach improved healthcare access and health education in remote areas. Furthermore, Rwanda also implemented policies aimed at reducing disparities in health outcomes among different socioeconomic groups. This included targeted interventions to address malnutrition, infectious diseases, and maternal and child health. So now let's focus on the results. So Rwanda's efforts led to significant improvements in key health indicators such as reduced child mortality, increased life expectancy, and improved access to healthcare services. The country's success in tackling health disparities demonstrates how focused policies and investments can make a substantial difference in improving public health, even in resource-constrained settings. These case studies illustrate the impact of global health economics in addressing pressing health issues and show how countries can successfully tackle health disparities through targeted policies and investments. They highlight the importance of evidence-based approaches, international collaborations, and innovative financing mechanisms in achieving better health outcomes on a global scale. So all in all, economics and healthcare are intricately linked, forming a dynamic partnership that impacts the very core of our existence.
The allocation of resources, the affordability of treatments, the development of life-saving medication, and the accessibility of healthcare services hinge on economic factors.
Thank you. Thank you everyone for tuning in to another episode. We hope you've gained valuable insights into the economic challenges and disparities in global healthcare systems.
If you have any questions or want to continue the conversation, feel free to reach out to us on social media or through our website. We'd love to hear your thoughts and feedback.
And remember, by understanding these global health economics issues, we can all play a part in creating a healthier and more equitable world.
Stay informed, stay healthy, and take care. Goodbye.